Good morning, all, and thank you for coming here. I'm Carmen de Mare-Hering from Costa Rica, and I want to talk about how to diminish the lethality of infectious disease. So this is a presentation that I'm very glad to give it to you, and it's based on the experience from outbreaks AH1N1 and COVID. Oh, here you have my data. Feel free to call now that you're seeing this poster, and please find everything okay. So, what we want to know is uh, how many fatalities come from an outbreak or an endemic disease, and define how can we make people to be have a less severe disease. So why we're dealing with lethality? Because this is what it's a widely measured, and it's very difficult to hide the deaths we have, and everyone talks about lethality. Here I've given you an example of The Economist, that it's currently tracking the excess deaths and seeing how many could be attributed to COVID-19 to date. So what we have here, what's lethality is how many people died in a population in a given time. So in infectious disease, um, this has a meaning uh, of how we measure this, and we measure how many people that are in the population that get infected. It's not the same thing to have a disease that if you get in touch with someone or the host or the reservoir, you get uh, like lepra, you give a very, very low possibility to get infected, as if you get measles, that it's very possible that you will get the disease. So, how many people get the disease when they are exposed? And the other thing that it's very important to make the decision is how virulent is the disease. It means virulence is measured in two ways: how many people died, the fatality, and how many severe cases we have. There are diseases that do not kill people, but do harm them in ways that they become disabled. So we have to know the proportion of this case to decide. For examples, you will be more prone to do a campaign against meningitis than a campaign against common flu, even though they're very different in their infectivity. The severity of the meningitis makes it, if you have a new meningitis or a meningitis, it's augmenting, then you should take measures. Some determinants that are useful for making decision making from a public health is what's the organism that's causing the disease? Is it a known organism or is it not? Is it viral? Is it bacterial? Is it the fungus? And we have also how it is transmitted. And in this case, it may apply that if it has hosts, and in many cases, if it has reservoirs, because this will change how we will take the measures. Also, it is very important, and we're on October 12. In 1492, Christopher Columbus put foot on America, and many people like William McNeill from the book, Plagues and People, who did historic epidemiology, might say that in part why the Aztecs and all Indians saw Cortés as a god, it might be because of the disease that they brought. So you might take and know how an emerging or a new disease manifests in humans than when it's an endemic or a already adapted disease to the human. An example is syphilis, how it was in 18th century and how it manifests today. And also the characteristics of the population. You should know which population you're dealing with. It's not the same to deal with cancer patients or a population that has some genetic prevalence of for some diseases.